Now, I just want to look at Cubitus varus and Cubitus valgus, which are basically two arm disfiguring situations or conditions, medical conditions. They actually disfigure your arm. Okay, so this image could be better. Okay, so this is what is known as the Cubitus valgus and Cubitus varus. This one is gunstock deformity, but we're not talking about this one. We're talking about this one. So one is pointing your arm inside, one is taking your arm outside. The varus is outside, the valgus is pointing your arm inside. So this is just to talk about the effect. It could be disfiguring and also can cause ulnar palsy. This is basically the complications we're talking about. Okay. So varus is your hand is pointing inside. Valgus it to be outside, you know. So cubitus varus and cubitus valgus are common deformities, and most of the times they occur when there is what malunion of the supracondylar fractures. So you had a fracture and it didn't heal well. You have a fracture at this downside of your forearm and it didn't heal well. Of your arm rather. Okay? Downside of your arm. So cubitus varus, you can also call it gunstock. It's just that okay. So this one have to do with the forearm deviates inward when the elbow is extended. It's pointing inward. Okay. So it's cosmetically obvious. That's why they say it is disfiguring, especially when the arms are held straight. So the deformity is usually permanent unless they do a surgery to, correct it. Although function is often preserved, you can still use your hand, but of course, the you know the way your arm is, you won't really enjoy using your hand like that. You understand? So other issues include there's altered biomechanics of the elbow and the shoulder. Okay, which may actually predispose uh, to ulnar nerve palsy. Okay, because your shoulder is abnormal, the nerves around that side could get injured. So cubitus valgus now, which is basically your elbow, that's this angle. Your forearm is pointing out. Okay, the forearm deviates outward excessively when the elbow is extended. It may cause late ulnar nerve palsy. So the increased carrying angle stretches the ulnar nerve because the ulnar nerve is along the medial epicondyle. So over time, the continuous stretching leads to ulnar nerve palsy. The nerve is stretched too much. Do you understand? So it leads to complications. So symptoms include, of course, if your nerve is disturbed, it becomes numb. The part of the body that nerve is supplying for sensation will not be sensing again. So it's numb, and the muscles there they are no longer strong. They are becoming weak and clawing deformity. Okay. So, but unlike cubitus varus, cubitus valgus is less of an issue cosmetically. Cosmetically means how the patient will be disturbed that they are seeing their self. Do you understand? So that's it for this.